Dear students, welcome back. In the previous session, we have seen the skin, that is the first layer of the anterior abdominal wall. Now, in this session, we are going to see the superficial fascia, which is the second layer of the anterior abdominal wall. Okay, so in this superficial fascia, it is having two layers. One is the superficial fatty layer and the deeper membranous layer. The superficial fatty layer is called as Camper's fascia and the deep membranous layer is called as Scarpa's fascia. This superficial facial layers, which are not very much clearly differentiated in the abdominal wall above the umbilicus, and below the umbilicus, that is the lower abdominal region, we will find such kind of differentiation, that is the superficial fatty layer as well as the deeper membranous layers. So such kind of two layers of differentiation can be seen only below the level of the umbilicus, not above the level of umbilicus. So this fatty layer and the membranous layers are very much attached. We can simply, they are fused in the above abdominal, that is called upper abdominal region. In the lower abdominal region, that is below the umbilicus, we can find such kind of differentiation, that is superficial layer and deep layer. Superficial layer is called as fascia of Camper or Camper's fascia, that is fatty layer, and the deep layer is called as fascia of Scarpa or Scarpa's fascia or membranous layer. There are various contents of the superficial fascia run between these two layers. Okay, and this fatty layer is continuous with the superficial fascia of the adjoining part of the body. Okay, so when it comes to the level of penis, it is devoid of fat. So that means this fatty layer is absent in the case of penis and in the scrotum also. In the scrotum, this fatty layer is replaced by the dartos muscle. That thing now we are going to see in this session. So here you can see this. This is the lower abdomen, which is seen in sagittal planes or sagittal section here. So this is the pubic symphysis here. Oh, up to here, this one, what is that fatty layer is attached to the adjoining body parts, and this membranous layer is only continued into the penis. So in the penis, when you see in the penis, this fatty layer is absent and this membranous layer is going to continue around this penis, and this one is going to enter into the scrotum. Okay, scrotum over the dartos muscle, and this membranous layer is nothing but superficial fascia. This superficial fascia is finally fused or attached with the fascia of the perineum called as collis fascia. So this one is finally attached to the superficial fascia of the perineum known as collis fascia. The dartos muscle is present in scrotum, which is a smooth muscle. This one is replaced in the place of fatty layer of the superficial fascia. Okay, so you know this perineum. Perineum is the area extending from the anus to the scrotum, in between the anus to the scrotum. Okay. And also here the perineal membrane is also present here. This perineal membrane is a thick triangular horizontal layer of dense tough fascia in the perineum, which divides the urogenital triangle, into superficial and deep perineal pouches. That is the importance of this perineal membrane. Okay, so what is the main function of this membranous layer, which is finally attached to the collis fascia? So the function of this scarpa's fascia of the abdomen and the collis fascia of the perineum is they prevent the passage of extravasated urine. That means some urine which is thrown back due to the rupture of the urethra. Here you can find this urethra. So when there is a rupture of urethra, so this layer prevents the extravasated urine into the ischiorectal fossa and downwards towards the thigh. Why thigh means, so this membranous layer is extended in such a way. So that thing we can see in the anterior view, that is the coronal view. We can call it as coronal view or anterior view. So here you can find in this pic, this one is umbilicus, and then these are anterior superior iliac spines. This one is pubic tubercle, and this one is the inguinal ligaments, and this is pubic symphysis, this is pubic arch. Okay, now we will see this membranous layer, how it is extending. Here you can find these dotted lines, that is the extension or the attachments of this membranous layer. So the first one is, it is starting from the pubic tubercle. A line is present that is called as Holden's line. It begins little lateral to the pubic tubercle and extends laterally to 8 centimeters. Okay, and it runs downwards and it extends to the pubic tubercle and it runs somewhat downwards, that is the body of the pubis, and the deep fascia on the adductor longus and the gracilis. So here this is the place where these two muscles are originating, that is the body of the pubis, and also the margins of the pubic arch. And finally it attaches to the posterior border of the perineal membrane. So this is the perineal membrane. So it is attached to the posterior border of the perineal membrane. So the same thing on both the sides. And above, so and also it is extending the membranous layer above the inguinal ligament over the umbilicus. Okay, above this umbilicus, this membranous layer and the fatty layer merges together. So that is above umbilicus. The two layers will fuse or merges with each other. Okay, below the umbilicus only we can find such kind of differentiation of membranous layer as well as the superficial fatty layer. So this fascia, so as a whole, the superficial fascia contains, okay, extremely variable quantity of fat which tends to accumulate in the lower part of the abdomen after puberty, and also cutaneous nerves, cutaneous vessels and superficial lymphatics are the contents of the superficial fascia. And Another important structures which are related to this membranous layer or the suspensory ligament and fundiform ligament of penis or clitoris. Okay, so how these ligaments are formed? So this suspensory ligament of penis and fundiform ligament of penis both are formed from the membranous layer of the superficial fascia. So now we will see the suspensory ligament of the penis, so which is derived from the Scarpa's fascia, that is the membranous Scarpa's fascia of the abdominal wall. It extends from the pubic symphysis, which holds the penis close to the pubic bone, and support the penis when it is in erect position. So the suspensory ligament is also derived from the membranous fascia, membranous layer, that is Scarpa's fascia of the anterior abdominal wall, which is attached to the pubic symphysis, which holds the penis close to the pubic bone and supports the penis when it is erect. And coming to the fundiform ligament, this fundiform ligament is also derived from the membranous Scarpa's fascia of the anterior abdominal wall. It extends from the linea alba. So we know that is the vertical groove which is present in the anterior median plane. It extends from the linea alba to the penis and surrounds it laterally on the both sides of the penis. It is present like sling-like structure. Okay, it is present like as sling-like structure, and it ends in the scrotal septum. This is the fundiform ligament of penis. This is present superficial to the suspensory ligament of penis. These are the two important ligaments which are formed from the membranous layer. So at these parts, this membranous layer is thickened, which is seen in the median plane. So this is all about the superficial fascia, and in the next session we are going to see the contents of the superficial fascia, that is cutaneous nerves, cutaneous vessels, and the superficial lymphatics. Thank you.